our student recipient is Owen Parra. You have a description of Owen and his work there. I'll do a brief version with a little bit of an add-on. So Owen is a graduating student this year, fourth-year medical student here at Penn. I won't say the name of our medical school because when I came 46 years ago, it did not have a name appended to it. So I still think of it that way. Prior to medical school, so he graduated undergraduate from Tulane. Prior to medical school, spent years, 3 years, in fact, working in an HIV prevention community clinic. And, you know, you're in a setting like that, you see all kinds of people from all kinds of places. And this was really, I think, maybe the genesis of what inspired Owen, one, to progress into the field of medicine and his dedication to helping underserved peoples. And he continued that in medical school. You know, I'm not going to read it, you know, a variety of locations while he was in school here at Penn, including clinical rotation in our flagship program in Botswana. And I would say, you know, in reading Owen's kind of summary statement, you know, his application statement or whatever we would call it, the things that maybe resonated the most, and many of us see this when we work globally, is there are many, many commonalities that occur in the practice of medicine, certainly the need for care, and those are constant, and so there are lessons we can learn and translate to other settings. But those are always cast on incredibly different environments with different kinds of people who approach the challenges that I guess we'll all face in time if we haven't already in the need for great care. So Owen, come on up. Congratulations.
Thank you. My name is Owen again. I'm a fourth-year medical student. I will be graduating in just a few days from here. I just want to start off by saying thank you to the Suskinds and to everybody on the selection committee for this award. It really means a lot to me, and I'm honored to be here with you all today. I just wanted to speak a little bit about myself and just what global health means to me, as well as kind of my journey. Got a little brief summary statement, but just going a little bit into my background. I was born and raised in Kansas City, Kansas. That's my whole family here. Happy that a lot of them are here today. I get to go back and visit them quite a bit, but it's nice to have them visit me in Philly for a change. But I grew up there most of my life. I come from a mixed background, so my mom's family is German and Irish, and they've lived in Kansas for a little while. And then my dad's family, my grandparents immigrated from Cuba. So they immigrated from Cuba over to Spain and then here to the United States. My grandpa in particular was studying medicine down in Cuba before he fled in the 60s to Spain, where he finished his medical studies in Salamanca before he came here for residency in the US. And he ended up becoming a family medicine practitioner. My dad followed in his footsteps, also became a family medicine practitioner from the University of Kansas Medical School. And I'm following in their footsteps in internal medicine, so close, but not quite the same. But I'm still kind of modeling a lot of my career after what they did. So when I went to undergrad, I already had medicine on my mind. It had been something that I'd seen throughout my whole life. So I initially was studying neuroscience and psychology, but when I was there, I discovered a few small classes that were in international development, things that were really focused on public health policy and just public health initiatives across the globe. And I really fell in love with those classes. They were my favorite classes that I took the first few years that I was there. So I ended up pursuing that as a more formal degree as well, in addition to these other studies. And as I was deciding what to do with the rest of my career, I decided to take some years out before going to medical school and focus more on the public health side of things because of these studies, which led me to work at this clinic here. So worked at this small little clinic in New Orleans called Crescent Care. A lot of what I was doing at that time was around HIV prevention within the city. Would do a lot of harm reduction, a lot of HIV testing and linkage to care. Worked alongside a lot of primary care and infectious disease physicians. And then I also just did a lot of research into different barriers to care that various underserved communities helped or faced. We served a lot of different communities, including undocumented individuals, people from LGBTQ plus communities, as well as people that were without housing, people that were impacted by substance use. So a lot of my work was in this building right here, but most of my work was really in the field. And that's what I really fell in love with when I was there, was getting to really be on the ground and go into these different communities, meet different community leaders, get a chance to really understand what their lives were like, what the barriers that they and the people in the community faced, and what they really needed from the healthcare system. We were able to get a lot of people that had fallen out of the healthcare system linked back into care through these initiatives, and we truly would go anywhere. I mean, this building right up here is an abandoned Navy base that we would go into a couple times a month and just meet people that were living in there, go sit with them for a few hours, talk to them, provide them resources that they might need, and then we would see them in the clinic just weeks later. We would go to encampments, we would go to churches, community centers, all over the place. We would work in the garage doing harm reduction, giving out clean syringes for HIV prevention, and then just distributing a lot of different resources. So this is really where I found the world of public health and just realized that I wanted to be on the ground, wanted to be working with people. But this was also at the time of COVID. So about 6 months into working there was when the pandemic hit. And at that time, I was working alongside a lot of primary care and infectious disease physicians that were dealing with that, which is what really ended up inspiring me to venture back into medical school, because I realized that there was a way to merge this public and eventually global health interest with the practice of medicine where I could really have an impact on patients' lives. So that led me here to Penn. When I interviewed here, one of the things that stood out to me most, I remember talking to my interviewer on my interview day about the global health opportunities and how you could get some early exposure, but also how there were so many different programs that would send you abroad and actually get you on the ground, which was really what I was looking for. So that put Penn right at the top of my list. When I first got here, within my first year, I started working at the Penn Refugee Clinic as a volunteer, would meet with people who are seeking asylum here in the US and help them follow up after their appointments, make sure they got their medications. Also started working at the Center for Surgical Health that first year, which is where I got a little more in-depth work with individuals. I would spend months and months with them, helping them get emergency insurance for surgeries that they needed, and going to appointments with them, following up with them, following the procedures. I actually ran into one of them just a few months back. He recognized me in a coffee shop, and he was an undocumented individual, but he has since been able to get his documentation. So I was really happy to see him, and he came up and gave me a big hug. So I did that for my first few years here. My first summer here, I also continued some of my public health work through my internship at Philadelphia Fight, which was a lot of similar work to what I did in New Orleans, but with mostly adolescents. And then more recently, I've taken on some research as well. I work with Dr. Bill Short, and we are studying some of these novel HIV antiretroviral regimens that are long-acting injectables that can help with people that struggle with adherence to oral regimens. So we've been doing a number of different studies on these with the main focus of eventually reducing perinatal HIV transmission, which is a major public health concern in the US, but the highest burden of perinatal HIV transmission impacts the area that I have gotten the chance to work in now and that I hope to continue working in the future, which is sub-Saharan Africa. So this all kind of culminated in my global health experience, where I got to go to Botswana this last September. Again, when I came to medical school, I knew that this was something I wanted to do, and so it was really exciting when I actually had the opportunity to do it. I was a little nervous because if you like something a lot, it gets built up in your head a little bit, and then you don't know what happens when you actually get there. So when I got there, I didn't really know what to expect. I had read about this for years. I'd been looking forward to it for years, and it was truly the best experience I've had of medical school. I would say of any rotation that I did, it was the most comfortable that I felt the entire time in a hospital system. And I think a lot of that ties back to the work that I did in New Orleans, because I felt kind of at home. I felt like I was on the ground working with people and getting to actually speak with them and understand their problems, getting to know community leaders. And I learned a lot in that time. I'm interested in infectious disease. I saw a lot of infectious disease. I'm interested in public health, and I saw a lot of the ways that social determinants of health impact people across the globe. And as alluded to a little bit earlier, I think one of the main takeaways that I had from this was that it was not very different than what we do here. A lot of the ways that these physicians practice was very similar, just in a different context. And even despite these resource limitations, there was always people that were looking out for their patients, and that was really inspiring to me. This is just me at Princess Marina. So I would say that this experience was a really great learning experience, but beyond that, it really transformed what I want to do with my career. I had been interested in global health, but this was really a confirmation that this was what I wanted to continue doing with my career going forward. I actually interviewed for residency shortly after this, and I did not include a single program that did not have a global health track in it. Every single program that I came to, that was my first question. I was like, what global health opportunities do you have? When can I go abroad? How early? And that all led to me matching at NYU this past March. So I'll be moving up to New York here shortly, and I'll be predominantly working at Bellevue. I've already actually connected with the global health director. She did interview me personally, and we'll likely be going to Ghana as well as potentially some other places. Yes, thank you. And also excitingly, my clinic will be at Bellevue, and so most of my patients will be refugees and asylum seekers, which I'm very, very grateful that I get that opportunity. And then the future plan is to eventually go into infectious disease and continue this work. I love doing this clinical work abroad. I love the research that I get to do, and I want to carry it forward. A lot of people to say thank you that got me this far. I mean, the Penn Center for Global Health, I just am so grateful to you all. These have been just incredible experiences. Everybody at the University of Botswana and in Botswana that I got to meet. Right here is Tiny. She hosted us in Machuti, and she's the best. And these were my co-meds as well. So I met some great people over there. So I want to thank everybody here, and then also my family. Just thank you for everything that you've done for me as well. And lastly, I just want to thank the Suskinds. They are incredible people. I am so fortunate that I got to meet them a little over a month ago. I have been extremely inspired by all the work that they've done, and I really will probably be modeling most of my career after what they've done as well. And it's just an honor to be a small part of their legacy. So thank you.